When allergies strike, safe medications to consider include Diphenhydramine, Loratidine, and Cetirizine. For those pesky cold and flu symptoms, you might turn to Diphenhydramine, Dextromethorphan, Guaifenesin, Vicks Vapor Rub, mentholated or non-mentholated cough drops, Pseudoephedrine after the first trimester, Acetaminophen, Saline, nasal drops or spray, or a warm salt water gargle. Remember not to take the SA or multi-symptom forms of these drugs, and steer clear of Nyquil due to its high alcohol content. If diarrhea becomes an issue, loperamide is a safe option after the first trimester, but only for 24 hours. To alleviate constipation, you might consider methyl cellulose fiber, docusate psyllium polycarbophil, or polyethylene glycol. Remember, polyethylene glycol is for occasional use only. For minor cuts and scrapes, bacitracin and neomycin polymyxin B-bacitracin are safe first aid ointments to use. Headaches can be safely managed with Acetaminophen. Heartburn can be a common issue during pregnancy. For relief, consider aluminum hydroxide magnesium carbonate, famotidine, aluminum hydroxide magnesium hydroxide, calcium carbonate magnesium carbonate, calcium carbonate, or ranitidine. Note that aluminum hydroxide magnesium carbonate is for occasional use only. Hemorrhoids can be treated with phenylephrine mineral oil, petrolatum, or witch hazel. If you need to ward off insects, NN-diethylmetatoluamide is a safe repellent. Nausea and vomiting can be controlled with diphenhydramine or vitamin B6. For rashes, consider diphenhydramine cream, hydrocortisone cream or ointment, or an oatmeal bath. If sleep is elusive, diphenhydramine can help. Finally, for yeast infections, meconazole is a safe choice. Remember, no drug can be considered 100% safe to use during pregnancy. Today, we've broken down a comprehensive list of safe medications across a range of remedies. From allergies to heartburn, sleep issues to yeast infections, there are safe medication options available to help manage your symptoms during pregnancy. Always remember, your health and the health of your baby are paramount. Consult with your healthcare provider and make informed choices about the medications you take during pregnancy.